good afternoon and welcome to our community webinar on October 4th. It's hard to believe that we're already in October. I actually had to schedule an appointment for December already. So welcome to our fall community webinar, and we're excited to have Golden Valley with us today. Before I get started, and pass it over to our speakers today, I'm just going to go over a couple housekeeping items. We are utilizing the On24 platform, which is a web-based platform. So we recommend using Google Chrome, close out a VPN, multiple tabs. That'll help with your bandwidth. There is no dial-in number, so check your speaker settings and do a quick refresh. If you are experiencing any audio issues, definitely check your settings. We do have several engagement tools you should be able to see. The media player where you can see our beautiful speakers that you can adjust. We also have a closed caption if you need it. There is a presentation area. Because this is mostly a discussion, you can actually close out of that if you want to. There is a resources section, so feel free to download those resources. There is a certificate of attendance for today. And so if you do want to utilize that to request CEUs at an association, you can, but that is just a certificate to say that you attended today. Please ask questions. We'll get to as many as we can at the end, utilizing the Q&A section. And again, we'll get to as many as we can at the end. And then complete the survey at the end. We ask you to let us know how we did, and that's always going to help us for the future. And so again, we're really excited to be hosting Golden Valley Memorial with us today. And I'm going to go ahead and pass it over to Kathy Harkness as our moderator today, who will introduce our speakers. So Kathy?
Thank you, Lisa, and welcome to everyone. I'm really excited that we have a great attendance, and I think you're really going to enjoy listening to these great ladies from Golden Valley Memorial Healthcare. You know, they've had a great journey. They started their program during a time when most of us were locked down and, and struggling with, a lot of the crisis that was going on during COVID. But they were, had this planned and, they were working on, getting their program going. And during that time, they reached out and were looking for vendors. And we get the privilege of being their partner with CDI Collaborate, which they went live in 2022. So I welcome them today and am excited about learning about a little bit more and sharing with you about what they are. So I'm going to turn it over to Leela and Tara. And if Leela, you'll give us a quick introduction of who you are and your role there, and then I'll turn it over to Tara.
Hi, I'm Leela Hauk. I have been with Golden Valley for going on 8 years now. I've held a couple of different roles. I've done chart analysis at first for our inpatient observations. From there, I went to utilization review. And from utilization review, I jumped on the CDI bandwagon.
And we're so grateful she did. Hey, good afternoon, everyone. I am Tara Dole. I've been at Golden Valley for 12 years now. I'm our Executive Director of Compliance, Privacy, and Data Integrity. So our health informatics, case management, compliance, charge master, coding and release of information, population health as well, all of those teams report up through me, including CDI.
Okay. Tara, do you mind just giving a little background about Golden Valley, just about the, your community status, and just give us a little, not huge, you don't have to go into the P&L, but just you can go into, just give us a quick overview.
Absolutely. We are a rural facility. We are about an hour southeast of Kansas City, Missouri, and we are licensed for 56 beds. We've got four total clinics, including 3 remote clinics, as well as multiple specialties. We're also part of an accountable care organization, or ACO, so we're very much on that value-based care journey here at Golden Valley as well.
Well, let's talk about the other journey that we're here to talking about, is that CDI program. So give us, I said that, you started this, kind of during COVID and in 2020, and talk to us about, what you were looking for in a program and kind of the journey of pre-Collaborate.
Absolutely. Yeah, we knew it was something that we wanted to pursue. I, like many of you, I'm sure, received that lovely Pepper report from CMS, right? And get a lot of insights regarding, CC, MCC capture or lack thereof. In our case, some of it was certainly lack thereof. So we knew, we needed a program, and in a rural community, it can certainly be hard to recruit folks. And so I was confident we could build our program from the ground up and with internal resources. So I twisted Leela's arm, and she graciously agreed to join me on this journey and build our program. And so we did a analysis to see what kind of query opportunities there would be and potential return on investment, as well as what that case mix index shift could potentially look like. And so once we did that, then we had started our process totally manually, if you will. So we launched CDI in Microsoft Excel. So Leela tracked all of her reviews in Excel. We tracked our key performance indicators and financial metrics in Excel. Our query process for our providers was totally manual. We're not necessarily proud of it, but it worked, and it's what we had available at the time to be able to prove that return on investment to administration and senior leadership so that we could justify the cost of software. So once we got to that point, then we were ready to select a vendor partner to help make our processes more efficient and help us be more productive so that we could spend more time doing CDI and doing the work as opposed to trying to track our efforts and track down providers. So at that point, we signed with Collaborate. We were, of all the vendors we looked at, the software was the most, I really felt like it kind of met you where you're at, if you will. So if you had a CDIS with 10 years of experience, great. And if you had someone that perhaps didn't have any experience, in our case, and we were really going to be kind of learning from the ground up, we really felt like Collaborate stood apart from other vendors with that.
So it sounds like, you did look at a lot of vendors. I mean, we have a lot of competitors out there in the field. When you were doing that, was there a specific thing, an element about CDI Collaborate or about, CDI tools that you were, that kind of struck you?
Yes, there were several. One of the big things that I liked about Collaborate was the ability to have clinical insights, right? So if we did potentially have someone without as much CDI experience, or maybe, they didn't have as much clinical experience, to get those clinical insights and say, hey, you've got a patient with this BUN and this creatinine level, you might want to look at this. This could potentially be indicative of this clinical indication or this clinical condition. That was something that was very meaningful to me, because I was under the impression that we likely wouldn't be fortunate enough to hire someone with 10 years of experience. Just as a rural facility, that can be hard to do. So that's certainly one thing that was very impactful to me, as well as the NLU piece. So the natural language understanding and that embedded artificial intelligence to be able to use those insights and have your queries generate from that artificial intelligence. We've seen great success with that. I think our average our query capture from that NLU is about 70%.
Yeah, so that means for the viewers that about 70% of the queries that you send are generated from that natural language understanding insights that you're able to do. But let's talk about queries. Like many others, and back in the day, I would print out the queries and put them in red folders or put them in the charts, and they'd be different colors so that we could get the provider's attention and such. Talk to me about, when you were, in this tool or any tool really, how has your query process changed?
Yeah, so I will definitely let Leela speak to our current state. She's most equipped for that, but I can definitely tell you what our previous state was prior to Collaborate. And we generated a query in Microsoft Word. Leela probably had hundreds of documents saved for her query library, and she has the ability to work remotely. So she would print the query on site, and then we would have a staff member that would truly go and track down the provider. Sometimes they're waiting while the provider's on lunch break, or the provider says, hey, come come back and catch me at 3 o'clock, whatever the case may be. So there was definitely room for improvement there. Current state, I'll let Leela speak to.
Currently, yes, it has been a game changer. Now I can draft the queries in Collaborate. I send them. It goes through Meditech. It goes onto the patient's chart. The doctor sees it. It goes to his workload. He can answer it. The query response rate has been phenomenal. Usually it's that day or maybe the next day. And because of that, you know, the nurses can see that because it's on the patient's chart. Case management can see that. It's just a lot less headache, really. You don't have all these paper queries that you're trying to keep track of. Everything is in the system. You get an alert when the doctor has responded. So getting those queries, you know, noting them, noting the effect that it has on the account, it's just been a game changer. You're not logging all of that into an Excel spreadsheet.
In addition, that interface with our EHR has provided us a 100% physician response rate. I would say probably for the last year, I don't know that we've had one query go unresponded to, which is nice as well.
Yes.
Well, that says a lot for your physician team as well. So, you know, technology is great. You know, I mean, I'm not going to say that we don't appreciate the kudos there and the partnership with you around that. But boy, what a great team you have there for your providers that are able to do that. I just want to tell you, you know, for our viewers also, they do have Meditech Expand, so that you know, we talk about integration and things. For those of you out there that have that, you know, that's kind of interested, you know, in our medical, our EMR integrations and things. So not that we don't integrate with others, but I just want to call out theirs. So it sounds like, you know, obviously we wanted to get you some automation. We wanted to create some efficiencies. You know, query delivery is so big, but were there other goals that in your program that you were looking CDI Collaborate to work on as well?
Absolutely. So, you know, some other goals that we were really looking for were productivity, right? So as you can imagine, if we're doing everything in Excel, what I alluded to earlier, we spend a lot of time trying to track our work and keep track of our work, as opposed to being able to spending more time actually doing the work. So, you know, that was really a big one for us. And, you know, the productivity and our coverage has really driven everything. Certainly, you know, the more charts we can review, then the more financial impact they have, the more queries we're able to generate. Our case mix continues to climb. So really that productivity and efficiency that we gained, it was really tenfold for us because we saw it in every other key performance indicator that we were tracking, if that makes sense. You know, being able to cut out the paper has been a big thing for us. You know, one thing I don't think that I've mentioned that was also very important to us in the vendor selection process, and that we probably truly just take for granted today, is to being able to work in one platform. So, you know, we're able to launch Collaborate through the EHR, and then we can view everything within Collaborate. So Leela has the ability to see the medical record. She can search for medical record terms within Collaborate. So she's not having to toggle back and forth between the EHR and multiple other vendors. Of course, it launches seamlessly with our encoder as well, and the other 3M reference tools that are available. So really that seamless integration between the products helps drive that efficiency as well. And I think Leela's current productivity, I think she spends an average of like 16 to 17 minutes per encounter.
Great. Now your coverage in your population, is it just Medicare or all payers?
We primarily focus on Medicare. You know, certainly depending on what census allows for, then there is the potential to expand out into other payers, but Medicare is certainly our payer focus.
Okay, that's one of the questions that we get from previous webinar, you know, conversations. So I just want to clarify that for the group. So let's talk more about the NLU for a moment. How did you select, because our library is growing even as we speak. Our library consists of multiple, I think over 25 different clinical conditions, but then has clinical triggers around it. So we can set up multiple clinical triggers, around sepsis. Sepsis, there's lots of different ways to look for sepsis, a lot of different ways to clinically validate sepsis. So we have about 13 or 14 different sepsis trigger, opportunities. So going through that vast library, how did you take that on and deciding? And for those maybe need to back up here, we talk about natural language understanding and that artificial intelligence engine that we call in our business Catalyst. That's our brain that we use to develop these clinical triggers and look for these clinical conditions. That is what we deploy into CDI Collaborate to help you search and tee up opportunities within your patient population. So when we turn on these clinical triggers, we might turn on, anywhere from 10 to 20 to 30, depending on, what the need is and what the opportunity is at your organization. And so sometimes making that selection, there are some obvious ones, right? Sepsis, pneumonia, those ones are pretty much the foundation. I can probably go to any hospital in the country and say, hey, I bet your top 5 queries are heart failure, type of acuity, and, type of anemia. And, we could probably call those out. But when you're trying to, make that selection through this vast library, how did you go about doing that?
Sure. So, probably my biggest piece of advice would be to rely on your solutions advisor and your implementation specialist. They are very, very familiar with that NLU library and how it works. So we certainly relied on their insights. They asked a lot of probing questions or said, hey, you might consider this, or do you have any patients like this in your population? And Leela and I were shaking our heads, yes, saying, oh gosh, we wouldn't have thought of that, So I would definitely tell you to rely on them. They are the experts. They're going to get you through it. But, there were certainly some conditions that Leela had mentioned as being a thorn in her side, sepsis, as you mentioned, Kathy, as well as others, CHF, respiratory failure. I'm sure, no one's a stranger to those queries for certain. So, that's really what we started with, are those conditions that we knew that we were querying for with a lot of volume and frequency, and then relying on our implementation team to really guide us. The NLU is so powerful until you can see it, and they pull that library up for you the first time. It really is overwhelming. It's also a thing of beauty. And when I say it's overwhelming, it's because there are so many choices and options, and you do have the ability to just continue fine-tuning it and making tweaks until you get it working for you. And, we certainly have it working for us, which we're grateful for. And that really speaks to, again, I hate to just keep repeating our productivity and efficiency, but that 70% NLU query generation means 70% of the queries that Leela generates, she has had the help of NLU, if you will, to suggest those clinical conditions that need some additional attention.
And just, because I say it's growing basically like customers like you who say, there's a condition that we're dealing with here, and maybe other customers might have that condition and the opportunity, but maybe it's not built in our library. So with those, we do have the ability to create new clinical triggers for you, just so know that that's why it's growing, because there's always a different way to look at things. There's always different guidelines that come out. Malnutrition. Everybody is, that's one of those things where, it's like, well, I have, this criteria, but I really also want to look at this too. So, we know in the field that our lives are in a constant state of flux and change, in the sense that, rules change all the time, unfortunately. It's a lot of job security. And I love that you called our library a beautiful thing, overwhelming and beautiful. I'm going to have to be using that from now on. So thank you. I'd love to hear that, because I think it's the same thing. That's why I asked the question. I'm like, oh my gosh, how did you choose? And I think the other thing too is it's not, you don't, once you choose, and you can either tweak it to make it right, or, a better fit, or you can say, you know what, I don't think we need that one. Let's do something else. So
and that's
we're going to talk about that. So yeah, we're going to talk about that solution advisor role a little bit later, but that's the beauty. That's the other beautiful thing about that is we do have a person that is for the life of the contract that can help you be flexible in those decisions. So nothing is in stone at that point. Well, taking on a new product and implementing a product can be very daunting. And so let's talk about that implementation process. What did you do to help prepare, and how would you describe, that time?
Absolutely. I'll tell you what, we got homework every week on our weekly project calls that Collaborate led. They give you a project manager as part of that implementation, which we were incredibly grateful for. And so really we just focused on making sure we had our homework done each week, if you will, and reporting out on that progress. And, there are a lot of options along the way. So, our first option was, gosh, we've got queries available in the Collaborate query library. Do you have some of your own, internally that you'd like to use, a hybrid mix of the two, that sort of thing. So we made a lot of decisions like that, if you will, kind of around surrounding our initial build and launch and what that was going to be like, and then worked on those weekly project calls. We did, as I mentioned earlier, create multiple different interfaces because we've got our entire EHR coming in to Collaborate, as well as interfaces on the provider side to be able to query electronically within our EHR through Collaborate. So a lot of our interface work, of course, was done by our IT team as well as Collaborate's IT resources. And then we had training here on site, and then we were ready for go live. Leela and I talk about it and look back. We had an EHR conversion not too long before we implemented Collaborate as well. And it truly is the smoothest go live that we've ever participated in. There weren't any showstoppers or red flags, if you will. Each day got a little better. Leela certainly had to start her work from scratch, right? And we had talked about that. What does the cutover look like? And, I finally looked at her one day and we just kind of agreed, you have to start somewhere, right? You just have to cut over. And so we're like, we're not going to keep worrying about closing out what we were tracking in Excel. We can speak to why, we've got a gap in our metrics here for a few weeks, and it is what it is. We're moving on to better things. What would you like to add, Leela?
Just the, oh gosh, I don't know. I mean, it was very seamless. Literally we went live at midnight. I logged in the next morning, and it was all right there. Everything that I usually had to sort through or print out or try to organize in Excel, it was all right there. It was like I said, it was seamless.
And we had support the day of go live as well. So we had a project call, set up for the day of go live so that we could talk through any hiccups or perhaps anything that we had forgotten in training, or maybe, we just needed a little bit of positive reinforcement that we were on the right track, and continue to have calls, subsequently after go live. So. And
you had training on site. So you had an in-person training, because I know post-COVID, a lot of people have, we can do it off-site or we can do it on-site. So that is that is your call, not necessarily ours, because we will always be on-site if requested. But that was what you found that very helpful, to have somebody on-site with you.
We did, and we appreciated the option. Certainly with COVID, facilities have different policies regarding that, but just for Leela's level of comfort, as well as my personal preference, if you're going to be spending that much time training, sometimes it does just seem like it's more beneficial, or it just flows better. The virtual environment, if you're virtual for 8 hours, day in and day out training, it can sometimes be a little cumbersome. So we really enjoyed the on-site training, and if we did it again, that's certainly what we would opt for.
Yeah. I think the other thing that you mentioned that's really important, and I do a lot of sales conversations about our product. I always talk about, we talk about implementation, and I say dedicated resource, right? And that's from our side and yours. Because, that's where, if we have a dedicated, especially IT, and it, all organizations, no matter the size, their IT resources are stretched. And so we always talk about that. I try to always talk about that, trying to find one or two people that we can reach out to and say, we're setting up this file or we need this interface tested or whatever. Having that dedicated resource is probably a big game changer. So it sounds like you had that, and that's I can't understate the importance of that. The other thing is, we talked about interfaces. We do get a DRG feedback for reconciliation, so that's another one of those things that that we set up and test. So, and I don't know, I don't know if we talked about reconciliation, but that's one of the key pieces to making sure that the reporting and the analytics and all the information coming back, and that you're able to leverage and show return on your investment for the product. So, very important. So let's get to that special person that has really made a difference, and I think is one of the things that really made us stand out. So this is when we were acquired by 3M several years ago, we had adoption specialists for our products, our clinical solution products, and CDI Collaborate is one of them. 3M has seen, that has been a game changer for customer satisfaction. And so they are rolling out, that adoption specialist role in other products that they have. And we call them solution advisors now. So you hear us talk about adoption specialists versus solution advisors. It's a new title. So please, those listening, don't get confused. It's the same person. But CDI Collaborate, for the product, for the life of the contract, you are assigned a solution advisor to help you with the training, with the everyday questions, with the monthly meetings, with the reporting. And I'm going to introduce her this time. She is on the line, Laura Neal. If you'd like to introduce yourself and kind of just talk about your role for a second, and maybe I probably stole some of your thunder by talking about what you've done, so I apologize for that.
So yes, I am Laura Neal. I am an RN and a CDI specialist. I have worked as a CDI specialist and also as a leader, so I have that experience that I use in my role at 3M as a solution advisor. So my role is to help customers utilize their application in the most optimal way. And my goal is to ensure that the best outcomes, we get the best outcomes based on the determined success criteria, which Tara has spoken very well to their goals, and also, in a short time with CDI Collaborate, how they've met those goals. So the communication, the monthly meetings, and then emails in between, and the incredible insight that Leela has really helped us to tune their NLU to work well for them and to help meet those goals, like has already been called out. And it's really been a pleasure working with Tara and Leela and celebrating their successes with them.
So Tara and Leela, now you get to talk about Laura. Describe how, this feature, you've already said that, you were surprised that this was an asset that you had, for the life of the contract, and that this was a continued relationship. It wasn't just, hey, we're going to install this, and I hope it works for you. And, here's a 1-800 number. Let us know how you're doing. If you have a problem, call this number. That's never been our philosophy. We definitely are, we stand behind our products, and, we put talented people. All of our solution advisors for the CDI Collaborate products are CDI specialists, credentials, some inpatient, some outpatient, some both. So, we're very proud of the team that we have procured, and, and we are able to supply that to our customers. So I'm going to stop talking, and you guys can talk about how wonderful they are.
So your solutions advisor, and as is the case for us, we get Laura and we're so grateful. Truly makes all the difference. So especially, if you happen to be a smaller facility with limited resources, like Kathy mentioned earlier, to have somebody else to bounce ideas off of, and really to have the knowledge of the NLU as well as how Collaborate works. If we do see something that's a little different in a metric, between the three of us putting our heads together, we can usually pinpoint exactly, what it is. Okay, we need to make this tweak here, or we just didn't realize, that Collaborate worked this way. So to be able to have, additional suggestions and insights, and even, I've asked before, hey, well, what's the benchmark for this? What should we be shooting for, on a physician disagree rate or whatever the case may be? It's been very, very helpful. And, kind of like Kathy mentioned, after our go live, I fully expected we would walk away at some point, right? That's when vendors are hands off, or is typically the case, with my experience, anytime you've got a vendor partner. And so it really takes the meaning of a vendor partner to an entirely new level, because you truly do have a partner there at your fingertips that's really working alongside you, elbow to elbow. And it really makes all the difference. I'll let Leila share her personal insights. I guess the only other thing I would add too is that you have access to your solutions advisor by far more than just that monthly call. Laura usually responds same day via email, that sort of thing, and is also great about communicating product enhancements and insights, things that are coming down the pike that we might want to be aware of as well.
Like Tara said earlier, we started the CDI program literally from the ground up in 2020, and then in 2022 we went live. Even though Excel was a pain, being somebody new in the CDI world and just learning, I just started getting comfortable in Excel, and then we switched to the new program. But having Laura there, afterwards, after the go live, there was some hiccups, there were some different things that I had to do differently in Collaborate that the past 2 years I had done in Excel. And she was great. We could do, I could call her, we could do screen shares, and, help work through that flow. And just, if I provide feedback, another thing in the NLU, if you see something that maybe that they're picking up, if it's, then there's maybe a discrepancy, you can provide feedback in the NLU on a certain subject like respiratory failure or sepsis. And then they take that feedback. Laura looks at that feedback, and that also helps tweak then the NLU specific to your facility. And like I said, Tara said, just having, the access to her has really helped, the workflow and getting comfortable then with the Collaborate.
Yeah, I think I even remember a time or two, when we were discussing probably pretty soon after our go live about something that just hadn't quite clicked. And I think Laura said to Leila, well, how did you track this in Excel? And then, Laura was able to translate what we're tracking in Excel and how we're not able to find that in Collaborate. Yeah. So like I said, I think our experience has been fantastic, and Laura, as a solutions advisor, really, really makes the difference, I think, in your ability to leverage the product to get it to work for you, so that you, kind of what I said earlier, you're going to be as successful as the effort that you're willing to put in. And I can tell you that Laura puts in just as much effort as we do.
Well, what's nice is, just in the reporting, when you talked about that, it's like, how did you track this before? How are we looking at it? We do have self-service reporting in the JASTA reports, and so again, compared to other vendors, that might be, like, oh, well, you can download it, you can look at it. But what's nice with the monthly meetings is, she does look at those reports, and she's looking for those changes, does this look right? What happened? Did you have a surgeon go on vacation this week? Those kind of questions about that. So I think that's something that I am very proud to mention, during customer calls, is say, we're going to walk with you, through a lot of this. Now, when you talk about, we do have consulting services that take it to a different, level beyond, and our solution advisors do work with our consultants if customers have purchased those services. When you talk about, program analysis, deep level benchmarking, things like that. So I just want to call that out that, they are there to, do that one-on-one, but if there's more than what, they're focusing on, we do have those other services. One of the other questions I do see in the chat is wanting to know if you have 360, and no, they do not. So that is our other product that is our 360 Encompass, inpatient, outpatient CDI encoding. No, this is CDI Collaborate. This is a community-based, primarily CDI program. They do not have computer-assisted coding. This is a different product. But when we talk about NLU, for those of you who either are on the phone that are familiar with 360, the NLU that we brought with us from the M-Modal side is now available in 360. So all of the different libraries and the content conversations that we've had does apply to 360 if you have that. And so if you're wondering about that, we can, please reach out in the chat and we can get somebody to talk to you about how that NLU functionality that they're talking about is available in our other products. So, okay, so we're doing well on time, but I do want to talk about, let's look back just a second. What other things did you learn about this process and the selection and the implementation? In addition to, Laura's role, what would you have to share with others about, your journey?
Gosh, probably the biggest thing would just be to, be patient. I would say at Go Live, we were probably back to baseline within, 60 to 90 days, and probably sooner. I'd have to go back and look at our data. And then we really started seeing the gains as far as efficiency and productivity. And, just to, pick your battles. I think I said earlier, Rome wasn't built in a day. And so we're not going to have perfection in every single, metric that we're tracking and in every process at Go Live. And that's okay. Let's pick an area and focus on it and hardwire it and then move on to something else. So that would probably be my biggest advice. Do you have anything, Leila, you want to add?
Not really, other than just be patient. It is a learning curve. Then, you're learning a new program, but just don't get frustrated. I have a tendency to get frustrated with myself, but it just took, a little time, and just use your resources that you have. Use, your solution specialist. It just, I would say, like Tara said, just the time, give it time, and use the resources that you guys provide.
Yeah. And we talked a little bit in preparation for this, and Lulu, you shared with us that within the first 90 days was probably the hardest,
yes.
Time. And then you said at about 6 months, it was like, don't ever take this away from me. It was right. It was like, okay, we're good now. This is going to work, and this is strong. And I think that's why when you all keep saying be patient, it's very hard, especially, change is hard, whether it's good change or bad change. I mean, we all know that. But I think those were the time frames that you said, that the first 90 days, you're like, oh my gosh, everything is changing. What's new today? That's a long time. But by the 6-month mark, you were feeling pretty confident that this was going to be okay. Life was good.
And more than anything, the software works as designed and as you've built it right on day one. Really what Leila had mentioned when we were discussing this prior to hopping on today's webinar was really it's us working out our habits that we've created, right? So up to Go Live, and you just can't break all your old habits in a day. And then at the same time, you've also got to learn to create some new ones. So that's really, the biggest thing I think is just your processes internally that you've lined out, and just making sure that you're walking those to account for them within, your new operating system in that software. But yeah, I mean, by 6 months, Leela had it for sure.
And what's great, another thing that's great about it is you can tailor the program and the software to your facility. You can set up your workflows, how you like them, your work groups, how you sort things, how it sorts patients out. That's all at your fingertips, and you can, if you want to sort something different one day and the other, it's all right there. And like I said, it's really tailored. You can tailor it to your specific needs, and has been really nice.
So basically the prioritization is based on opportunity, based on the NLU opportunities. The NLU, natural language understanding, which is built on natural language processing. So most people understand NLP. We call it NLU because we take in more concepts than basic level processing. So it's a little bit more, a lot more expanded to take in other things like, what medications are being, administered, what lab studies, things, things that are a little bit more around clinical context or clinical concepts. That's why we call the NLU. But, by using that, that is something, again, that takes that understanding of what is it looking for? What is the engine looking for? And, is it like what I was looking for? It'll tell you what it found, and it'll also tell you what it didn't find based on those clinical triggers. So, there's a lot of, getting you to understand as well. And, it's a learning curve. When you were talking, reminded me of, I used to work with a customer that was having a lot of change and, had a lot of new staff and, habits and, getting through this implementation. And they had, I don't know where they got it, but they had a huge cutout of Elsa from Frozen. And on their board, it said, "Let it go." And that was their theme song, because sometimes you just have to let it go and embrace, what's coming. So I always think about that when people, say it was a kind of a joke, but it was a nice visual of, okay, I probably need to let this go, and it's going to be okay if I'm white knuckled to this, this flow sheet, this paper flow sheet that I've been using forever. So we understand that, and Laura's been there, and we've all been there, and so we're happy to get you to the other side. What would you consider your biggest win at this point?
I think our biggest win is truly just, having a solid program that runs itself. It does not require any, as a manager, executive, administrator, whatever your role is, whatever has the most fires is what gets all of your attention, right? It's what's draining your time and resources. And I can definitely tell you that our CDI program is not one that drains any of my time or resources. And there are times where I truly don't, hear about from Laura or Leela about any concerns whatsoever. And we're just sharing wins on our monthly call. And that's great too, right? And I love to share those wins across our organization. So for me, as a executive director, that's truly a measure of success. And then as well as all of our key performance indicators that we track, and our coverage rate, productivity, efficiency, our financial impact, case mix, CC, MCC rates due to query, all of those, have just, I would say many of them have probably quadrupled since we went live, or when we were on manual based processes. So, and again, we haven't increased our staffing. We still just have Leela, as our one CDIS. And so we have really, really been pleased with the product. It's very user friendly, and it is certainly a tool that we rely on daily.
Leela, anything to add to that?
No, Tara really did a great job of summing it up. I mean, for me as, a CDI specialist, just the amount of productivity, like I said, I'm actually looking at charts. I'm not inputting, everything into Express, their account number, their medical record number, all that, just the productivity and, and then the financial impact that it's had.
The moving forward, as a partner with us, what's next for your program?
So one thing that we have in our strategic plan this year is outpatient CDI. So we're definitely currently, analyzing and looking at the feasibility of that and where we would want to focus our efforts, as well as what the return on investment would look like for an outpatient CDI program. And, certainly looking to partner with Collaborate and seeing, what additional resources we might want to invest in. We also are looking at our artificial speech recognition software that our providers use daily. They have asked us to, just really look at all vendor solutions and see what's out there. And, there's certainly some benefits if we are able to use Fluency Direct in conjunction with Collaborate, just to enhance our CDI and documentation efforts simultaneously.
And there's a great question that there from Lori. Was the system generated query? Do the providers ever get query fatigue? So I think there's a little bit of confusion when we say it is automated and it helps with the NLU. These are traditional written queries. These are not anything that Leela does not review, build, and generate. So Leela is composing these with the assistance of our NLU evidence that is found in the record. So what Tara just described with having the Fluency Direct, our speech tool, it is our speech technology also houses the vehicle to which we can send our queries. So we can do electronic queries to the Fluency Direct toolbar, which gives them another way for the providers to interact when they're composing a note. They can actually use that toolbar as a vehicle to open electronic queries from Leela. So that's kind of what would be the connection. And we actually, the brand name is CDI Engage One. It is offered with 360, but it is also offered with CDI Collaborate. So that next iteration of being able to create queries in Collaborate and send them electronically, not to the message center in Meditech, but actually sending it to a toolbar where providers would be, where they would be actually composing their notes and actually doing the work. So I just wanted, these are not automated queries. They are touched by Leela. She's actually composing them, generating them using her templates or our templates that we've shared with them if they wanted to use ours. But but we do have some automated type of opportunities. We call them nudges. So it's a little bit different. So I just wanted to, since we were talking about Fluency Direct in the next step, I thought I would just go ahead and answer that question and do some clarifications for the group out there. So at this time, I'm going to thank you all for your participation. We still have a few more minutes. So if there are any questions from the audience that I didn't get to, I know it's I did it a little differently, but I was able to see them pop up, and I thought it made sense to address them while we were having the conversation. And then, ladies, if there's anything else you'd like to add at this time, is there anything that we didn't cover today that you were just dying to get out there, or anything that I had forgotten to talk about?
I can't think of anything. No, just to kind of take on what you said, Kathy. They are not system-generated queries, and it truly is Leela that's pushing that query seamlessly through the interface. So she's able to query and collaborate, use all the tools. I love the word that you said as far as it's a nudge. That's exactly what I would say, that NLU is truly a help, right? So, but you get to pick, you can take it or leave it, right? You don't have to use it. And so that query is then sent by the CDIS through the EHR. The provider receives it in the EHR. And then once the provider's responded, then it's right there in the medical record for everyone to view.
So Lisa, I think we've gone through all of our topics for today. Are there any other questions out in the audience that I can't see that you might want to?
No, actually, no.
Okay.
You covered everything. This was a really great conversation and great webinar. Definitely thanking our speakers. I think it's really great to hear, the actual users, and I think it's always good to hear that we're not alone in our sometimes our struggles, but also our wins as well. And so I think it's just a really great perspective that they were able to share. Real quick, one question actually, as I was starting to say that did come in, and I think this would be a good one. Do you want to take that, Kathy?
Sure. The question is from April. She says, is there a benefit with this system for medical billing and coding? So Tara and Leila, do you guys want to, I have an answer, but I'll let you guys share from your perspective.
Yeah, absolutely. So certainly, the CDI benefit that we're all familiar with as it relates to medical billing and coding is that, there's an impact for our DRG, right? And those CC and MCC capture rates, which can make a difference in your reimbursement. So, from a financial perspective, there is certainly a benefit, but also with medical and billing and coding, we use for an encoder as well. And so all of those resources are embedded together seamlessly. And the communication between the CDIS and the coder, which Leila can probably speak to, is seamless. And we're also able to get our charts coded and finalized more timely, just due to being able to query electronically. Leila's not having to filter in Excel, scroll, through rows in a spreadsheet and say, well, gosh, what is this account on hold for, that sort of thing. We've got all that available to us right there in Collaborate. So if you think about, CDI, and it's truly kind of keeping like your rev cycle flywheel spinning, if you will, Collaborate is what's helping keep that spinning so that we can get those charts finalized more timely.
My take on that question, just to kind of follow up, I think that was on my mind too, about, the whole communication and visibility and all of that. But also, CDI Collaborate was built specifically for CDI specialists to be working cases and looking at reviews concurrently. With that said, when you turn it on, it reasons over the cases that come in, into the patients that come into the system, whether Leila opens it or not. So, it's going to be there. So if, let's say Leila didn't get to that case for whatever reason, she took a day off, have mercy, just give her a day off. The coder can, if they go to code the record and they have a question, the coder has a couple of different ways we set this up for customers. The coders can have access to the tool, and they can look it up themselves. They could go in there. They could see all of the findings from the NLU. They can create queries. So we can have coders. We can have that work in the tool. It is not a coding platform, which means that the CDI coding summary is a separate instance, code finder and coder, than what the final coder would use. So they don't share code. But we do send, if the coder doesn't have any questions and they final code it, we have an interface that goes back into Collaborate, so that when you're reconciling, you can see that final DRG populate, and it compares to what Leila, was her final working DRG. And then that's what the reports are generated on, and we show, impact of her work compared to what, was final coded and such. But coders can do concurrent coding. We do have a concurrent coding workflow that some organizations use, that they can assign a concurrent coder, that they can look at it, give feedback, and interact. But the two systems between the coder and the CDI are separate, and they don't necessarily share code. That product is 360 Encompass. So that's a whole different product if you want that type of level of integration. But in this service, this is where it's separated. But we do have customers that do have coders that work within Collaborate, but the final coding is in another system.
Awesome. No, that was great. I'm glad that that question came in because I think it was
That was a great question.
Yeah, great question. So yeah, thank you for that. So again, today was really great. The perspective was awesome, and being able to bring both Golden Valley together, but also having Laura join us as well to kind of give that perspective too. So thank you all very much. So as a reminder, check out the resources. We do have a few other on-demand webinars available that we've recently had. So definitely take a look at those. Those are, again, our on-demand webinars on our website, open to anyone, as well as a case study. And then if you would like to learn a little bit more about that, the CDI Collaborate, there is a fact sheet as well. And if you are interested in learning more within the in the portal, there is a learn more button. So if you would like to learn more, go ahead and let us know there. And so again, please fill out that survey for us. Let us know how we did. And again, we appreciate our speakers today, and we look forward to hosting you all again. So thank you, and definitely thank you to Kathy for being another doing another great moderator for us for webinars.
Well,
so thank you.
I have,
you're
I have
getting
one more
getting to be. Go ahead.
Oh, I was going to say, I have one more comment. You know, AHEMA is coming up. So any of you listening, if you're going to be at AHEMA this Sunday, Monday, and Tuesday, please come by the booth and come talk to me. I will be there and would love to meet current customers, new customers, anybody on the call that, wants to come by and say hi.
Yeah, that is that is great. I'm so glad you mentioned it. We were just talking about how excited we're going to be to see each other in just a few short days. So yeah, if you are attending AHEMA, safe travels. We're at booth 447. We have a couple tech demos. Kathy's actually going to be presenting. So yeah, definitely stop by and see us. We'd love to meet you. So. All right. Well, everyone, have a great rest of your Wednesday. And thank you again. We look forward to having you on our next webinar. Thank you.
Bye.